Welcome to International Weekly Meeting. We are on 85th edition. It's been 6 months. We have lost Dr. KK. 17th May, we lost him. And before we could make this session live, Dr. Monica was showing some of the initiatives what Dr. KK used to do it. I would request her just to show that couple of cards on the screen. This is one of the initiatives where he used to present the information on health by the way of infotainment, information on entertainment. This is how you guys remember. There were cards, playing cards, where every card has a health message. So this card has a health message on LDL. Similarly, cholesterol, heart, every card has it. And kids used to love. So this is women are normally protected by the from a heart attack. So all these messages were being printed. And this was showcased in one of the Perfect Health Mela, which was his initiative in 2001. This event is basically a joint event by the Government of India and Heartcare Foundation of India. And it was one of the most successful national awareness program which he used to run, where we used to see a number of almost like 100,000 people visiting in 3 days. This went digital a couple of years ago as a pandemic. So we do miss him, but he's there with us. Continuing with this CMAAO, when we lost him, he was the president of CMAAO, and he initiated all the national countries coming together as a think tank, as a roundtable discussion. And we continue that with the support of our family here. We support of the National Medical Association family. So thank you everyone for being here with us and continuing this part of it. We are discussing a very, very important topic every week on Saturday, Indian time, 9:30 a.m. We are live on Zoom. The Zoom ID is 841-4731-1677. This is an initiative what he took. And now we will proceed with this meeting. So today we have an update from all the national medical associations who are with us as a part of CMAAO. And we also have Dr. Monica Vasudev. She will present some kind of data on vaccine booster dose, and all other information which we have been missing over the last few weeks. She's an allergist and a clinical immunologist from USA. So Monica, would you like to present?
Yes, if you can give me the ability to share, thank you.
Yes.
Thank you, Saurabh, and thank you, CMAAO, for again letting me speak among you and to give a very brief update today to be able to have some time to generate conversation. There's been a lot of information regarding the pandemic, the vaccines, with new developments in terms of the CDC and FDA guidance on the use of the vaccines at this particular time in the pandemic. The slides are just representative of some of the more recent news events, and there are many more pieces of information that should be discussed, and we can continue that discussion following these slides. I'd like to just remember Dr. KK Agarwal and his 6 months. We are continuing to have issues related to the number of cases and the waves that we're in. We just heard from South Africa before the recording, about having no cases. In South Africa, this is a graph that I just generated a half an hour ago. This is from newsnodes.com. And South Africa is being depicted here in the orange line. And you can see that we have no cases. However, in the United States, that you can see in the navy blue line is undergoing its fifth wave, and currently this wave is exponential. As of today, we've had 122,000 new cases, with the 7-day average now showing greater than 50,000 hospitalizations and 1,900 deaths. I draw your attention to other countries, including India in the light blue. You have Singapore that you can see in the yellow, and you can see that they're undergoing a decline in their most recent surge. You can see Malaysia also, that has been mirroring the surge with the United States. And then we can see Brazil here in this light purple line. So recent news that has been newsworthy has been that the United States has provided emergency use authorization for the Pfizer-BioNTech vaccine in children ages 5 to 11. They found that the immune responses of children, which is measured through antibodies, were comparable to those of individuals who were 16 to 25 years of age. In addition, the vaccine was found to be 90.7% effective in preventing COVID-19 in disease in this age group. The safety was studied in approximately 3,100 children who received the vaccine, and no serious side effects have been detected in the ongoing study. So this was news release from the 29th of October, and we've had 3 weeks now of a vaccine that's been available for these children. So this was an editorial that was published in Science, and I believe that this is a very apt editorial to explain why vaccination in children is very important. And what I've done is I've summarized the salient points of this editorial. The first is what's highlighted in the blue box in the center. A vaccine is not a choice to get a vaccine. It's not a risk-free choice. Rather, it's a choice to take a different and more serious risk. So we know that COVID-19 can be a childhood illness, that 25% of infections in the United States are in children, that 6 million kids were infected, and tens of thousands actually have that disease. I'm sorry, I've written that incorrectly there. 700 children have died, and it's one of the top 10 causes of death in children. There has been no child that has died of vaccination. 2,400 children in this age group were studied when the Delta prominent strain was found, and the vaccine efficacy was 90.7% against symptomatic disease, and that's what I highlighted in the prior slide. The vaccine-associated myocarditis is mild and self-limited. The incidence is much lower in the 12 to 15 age group compared to the 16 to 25. The children go to school, our children play with friends, they're in extracurricular activities. They continue to need to meet and interact for social emotional development. How do we keep them safe? Due to this pandemic in the United States, 2,000 schools were closed due to the pandemic, and it affected over 100,000 students. That should be 1 million students. Vaccinating children may be the most impactful public health effort in the US has seen in decades, and it's one of the most important health decisions a parent will make. So this speaks to how important the immunization is in this particular age group. I'd like to now talk about the booster doses, which has been in the news for quite some time now. And today, we actually received further guidance on the booster doses. So what's the data that goes behind the use of the booster dose? So this is the study that was published from the data using the Pfizer-BioNTech vaccine for preventing severe outcomes in Israel, which was an observational study. And what you see here is two particular diagrams, one looking at COVID-19 related admissions in the hospital, and the second is COVID-19 related deaths. In those who are immunized, now those who received 2 doses, here depicted in the red, and those who've received the three doses, and received the third booster dose in the light blue. And what you can see is that the number of risk is much higher in those related to admission for those who've received 2 doses versus 3, and that risk increases with time. And again, you can see the same type of trend in those who passed away with COVID-19. So the vaccine effectiveness was evaluated 7 days after the receipt of the third dose, compared with receiving only 2 doses at least 5 months ago. And the vaccine effectiveness in those who received the third dose was estimated to be 93%. They found 231 events for those who received 2 doses without booster versus 29 events for those who received the booster dose. For those required admission to hospital, which I showed in panel A here, for 92% for severe disease, which I did not show, and then here 81% for COVID-19 related death. So this is providing data as to why booster doses is important. This is the data from the Pfizer-BioNTech phase 3 trial data showing that the COVID-19 vaccine booster had a relative vaccine efficacy of 95.6% against disease. In this study in phase 3, they had 10,000 participants who completed a 2-shot Pfizer regimen. Half of them were randomized to receive a further equal strength dose of the shot, and half received the placebo. What they found is that 5 cases of COVID were found in those who received the booster, compared to 109 who were given placebo. This particular study looked at effectiveness when the Delta variant was prevalent. And what's interesting here is that the median time between the second and third doses was about 11 months. So this is today's news. This was all over our news today. Rochelle Walensky from the CDC expanded the recommendations for booster shots to include all adults ages 18 years and older who received either Pfizer or Moderna at least 6 months after their second dose. Again, there was also emphasis to encourage those who've not even received the first dose to also receive their vaccine. So what is the state of vaccination as of today? The CDC reports that 195.9 million are fully vaccinated. And you can see the age group population. And now we're including data from those who are 5 years and older, showing 73.4% to those who are 65 and older, who are about 99.7%. And then if you're looking at the booster doses of those who are fully vaccinated, we're seeing again that as your age increases, the number of people who receive the boosters increases. And this data has dramatically changed now after Rochelle Walensky's announcement today. Let's look at what they received in terms of the vaccinations. So in the US, those who've received 2 doses are 108.5 million. Those who received the Moderna 2-dose series are about 71.5. And those who received the single-dose Janssen & Janssen viral vector vaccine, which is similar to the AstraZeneca vaccine, was 15.7. In the number of people who received a booster dose in the US, there's about 19.5 million who received the Pfizer, 13.5 with the Moderna, and they ended up getting the Johnson & Johnson with about 400,000. Now, I bring this slide up again because we're talking about mixing and matching of vaccines, and it's always important to remember that there's different platforms for each of the vaccines. The main players in terms of the vaccine platforms are the mRNA vaccine, which is your Pfizer and Moderna. These are the 2-dose vaccines. And then you have the viral vector vaccine seen in the upper right-hand corner, which is your AstraZeneca, your Johnson & Johnson. We also have the inactivated vaccines, which is the Sinovac and the Sinopharm. And then you have a new data that's being generated through studies for Novavax, which is a subunit vaccine. So in terms of the countries that we're talking about who have access to vaccines, who receive vaccines and are discussing boosters, would have received mostly the mRNA, the inactivated, or the viral vector vaccines. And it is important to understand where they are in terms of which family, Because when we're talking about mixing and matching, in my mind, it's about talking about platforms, not talking about vaccines within a single platform. To me, a mix and match is, say, Pfizer followed by AstraZeneca or vice versa, or Sinovac followed by AstraZeneca or Pfizer, for example, rather than Moderna or Pfizer. So should we mix and match vaccines? So this is a preprint publication. And what this is showing is that those who have received 2 doses of Pfizer as their initial series and who got boosted with either Pfizer, Moderna, or Johnson & Johnson, you are seeing the boost in terms of neutralizing antibodies as 31 times more, 32 times more for Moderna, who received Pfizer. Those who received Moderna received 11 and a half times more if they got it with Pfizer. And who received those with Johnson & Johnson got the stronger response with Moderna. So it was the strongest increase in neutralizing antibodies was among those who originally received the single Johnson & Johnson vaccine and then a Moderna booster. I was trying to find some information about Sinopharm and Sinovac, and I could not find that information prior to this today. So that's just some data to talk about mixing and matching. I also wanted to make a comment about the new oral antiviral therapies that have been in the news. We're talking about the Merck tablet, which is the 5-day course, which have the risk of hospitalization with people with mild or moderate forms of COVID. In November 4th, the UK was the first to approve this. Merck is working with Ridgeback Biotherapeutics in Miami. The mechanism of action is that it infuses mutations into the viral genome during viral replication. But they did caution to say that experiments suggest it can cause mutations in human DNA as well. And then there's the Pfizer pill that Paxlovid, which cut hospitalizations by 89%, and it inhibits the main protease that creates other essential proteins. This diagram comes from Science, and it shows here the 2 different mechanisms of actions of these 2 different tablets. So as SARS-CoV-2 infects cells and reproduces itself, it spreads. The coronavirus relies on dozens of viral and host proteins to complete its life cycle. The Pfizer pill, which is the diagram here on the left, inhibits the main viral protease that's used to create other proteins for the virus. And the Merck's drug inserts a defective RNA building block when the virus uses an enzyme known as polymerase to copy its genome. And so then you end up getting a defective viral genetic product. But that's what I wanted to do for an update today, and just wanted to remember Dr. KK Agarwal's 6 months of constant inspiration and presence among us. Thanks.
Thank you, Dr. Monica. I'm sure we have a lot of questions, so I will open the floor for questions.
Can I start with the question?
Absolutely.
Yeah, Dr. Monica, thank you. Wonderful. Actually, very informative. The only setback here is we don't have any information of whether Sinovac or Sinopharm, for that matter. Like I had said earlier in Malaysia, the 2 vaccines that was used was Pfizer, or 3 rather, Pfizer, Sinovac, and AstraZeneca. But right now, what is happening is the government of Malaysia is now giving the Pfizer as the booster dose. Now, this is causing a lot of concern among those who have taken the Sinovac as the first 2 doses. Now, how do we reassure them that it is safe or it may be good to take the 3rd dose, which is the Pfizer?
So there is, and I'm showing right now that, again, there is definitely evidence to show that mRNA vaccines that are the boosters following a non-mRNA vaccine, such as the viral vector, or like I said, with the platform sorry, I'm just trying to, so here we have Sinovac, which is an inactivated vaccine, and you're following it up with an RNA vaccine that you will have better benefit. And with that news article that I just showed you here, Thailand says that Pfizer spurs top responses after Sinovac's. So there are other countries that are doing this combination. And what I would definitely recommend, and if I was in that scenario, I would definitely take an mRNA vaccines booster if I didn't get that as my initial vaccine. Does that answer your question?
Yes, yes. Thank you. Thank you very much.
Can you talk about the gap which should be there between the vaccine and a booster?
Sure. So the actual press release from today said that there should be a 6-month gap between the second dose and your booster. So this is what Rochelle Walensky is showing here. She says that booster shots to include all adults ages 18 months and older who received a Pfizer, BioNTech, or Moderna vaccine at least 6 months after their second dose.
We can't see your screen. We can't.
Oh.
That's the old screen which is there. I think it didn't change. So probably you have to reshare, I think.
Okay. Okay. Can you see this?
Yeah.
Okay, so again, I'm showing you from Rochelle Walensky that here it says that all adults ages 18 and older who received a Pfizer, BioNTech, or Moderna vaccine at least 6 months after their second dose. Now, I know that some places are very particular in counting days from the last dose, and other people are walking in 4 months, 5 months later. I believe that 6 months is a good time to be able to get the vaccine. And even if you wait later, including that preprint data that I showed you earlier, that even up to 11 months, it's okay. So you would definitely benefit from a booster. We know with waning efficacy of these vaccines following the initial series that your risk for hospitalization goes up. We know the risk for disease goes up. We know that the risk for death goes up. So 6 months and later is when you should get the booster.
And is there
any reason? Sorry.
Go ahead.
Okay. Is there any reason the booster should not be given less than 6 months? Is it the waning efficacy?
Yeah, and reason and is there any complication also? That was my question.
Yes. Yeah. Correct.
So my personal view is that when we're giving immunizations or booster doses, it's not so clear cut. There are people who've had infections prior to their immunizations, people who've been infected after their immunization. And depending on the severity or the stimulus of the infection on your immune system, that's considered like a dose of a booster of whether it's immunization or through natural infection. I do not see any harm in getting the vaccine 4 months later, but I also don't think about the time about right now. I'm thinking about, well, we're going to be going into, in the Northern Hemisphere, we're going to be going into our winter season. We're going to be going into the flu season. We've seen many more cases of RSV. We've seen many more cases of influenza, just viral infections in general. And my personal experience, I will share. I got my initial Moderna vaccines in January and February. I have held off on my booster dose. And I want to get it in either December or January so that it'll protect me through the height of the flu season that we will have here. I rethink that decision every day. I'm still thinking about it. But I also, I'm trying to time it out because I don't know if they're going to recommend a fourth booster dose before the next cycle. I anticipate that next year, as we start getting our seasonal influenza immunization, the pandemic will become endemic, and then we will require an annual booster of our COVID-19 vaccine. So I am trying to give myself the best benefit by getting myself vaccinated either later in December or earlier in January, so that at least I'm better protected during the surge of the natural flu season that we have here. So I think there's many factors involved.
Dr. Monica, regarding the flu vaccine, what if you already taken your vaccine against the influenza? You know, we have that yearly. So let's say you've already taken the influenza vaccine, so in January,
Yes.
and
Yes.
now like you are waiting for next January to take your COVID because of the flu. What's up?
So when we had the flu vaccine, we were very happy when we had 50% efficacy, right? So we all know that the flu vaccine is not as effective as the COVID vaccine because there's an expected, circulating strains. And the problem with this year is that there was not enough flu last year to generate the data that we normally got about what the anticipated flu vaccine is. So we don't understand what the efficacy is. We also know that the adherence to flu vaccine administration was also very low. It was optional in the general public, potentially mandated in hospital settings. So it didn't get the same level as focus as maybe the COVID-19 vaccines. But say we got a flu vaccine, and I'm holding off on the COVID vaccine, it's the reason being is that any fever, any myalgia, any flu-like symptoms, any COVID-like symptoms will be confusing. And if you've gotten your COVID vaccine a little bit closer to the deeper flu season, you can feel a little bit more confident that any virus that you get, you'll be better protected in case it's a COVID infection. I hope that makes sense.
Yes.
Yeah.
Okay.
And is there any equation which gets changes if somebody has a severe COVID in the past and they had a couple of vaccine also? Like he's severely infected and he got out of COVID, and now he's got 2 doses of vaccine. Is that like this? I don't know, antibodies get changed, or does his equation get changed for the booster dose?
Okay, so that's a great question. So if somebody got severe COVID, first of all, was it during the Alpha wave? Was it during the Delta wave? How far back was it? And if the patient had really severe COVID, they likely will have some long COVID symptoms. There has been some data to suggest that immunizations and booster doses potentially may improve long COVID symptoms as well. So if you've had a prior infection and you have no contraindication to getting the vaccine, I would say go ahead and get the vaccine. If you had a severe infection, you had a reaction to the first dose, or you had very severe side effects, and you're hesitant to get the booster dose, you might be better protected because you had natural infection, but there's no guarantee. There's no guarantee. So if there is no hesitation to getting the booster dose, you should move forward with it, but do not use your prior infection as a marker of whether or not you should get it. It should be other factors that you are considering.
Let's say they've had 2 doses and then they are infected. Okay, they've recovered from the COVID. Are they recommended? Is it recommended that they take a booster dose post COVID infection? And what is the time frame after the infection that they should?
So I would not expect an immunization right away. The patients who are getting COVID right now, for the same reason that I'm waiting for my booster, I'll tell them, why don't you get that in January?
Okay.
Why don't you wait a little bit longer? However, if they get infected at Christmas, and what would I say to them? I don't know at that point, because I'm assuming that given the new CDC recommendations, that we'll now have an uptick in the number of people who will get the booster doses, especially those who will be meeting during Thanksgiving, those who will be meeting during Christmas. And so they want to protect those around them. Yeah, but I think there are many people who have been infected that haven't gotten tested, had milder symptoms, and they're all getting boosters. So we really don't understand the profile. of those who've been sick and when they should get their boosters.
But there is no harm for them to take a booster even after infection. I mean, after though they've had their 2 doses, they have had a COVID infection, and then now they're out of it. There is no sort of contraindication for them to take a booster.
No contraindication. The only thing was if you got monoclonal antibodies and you have to wait 3 months.
Okay, right. Thank you, Dr. Monica. A lot of questions actually for you.
No worries.
That explains why Ravi wanted you to be here. So any other any other one? Any other questions on the floor? And what about if somebody has a comorbid disease like high on diabetes or high risk patients, boosters are still recommended in the same way they have taken the old vaccines?
More recommended, right? Those who have risk factors or comorbid conditions should have no hesitation about getting the booster dose. And all these people who had comorbid conditions and who are older, they probably got their initial series earlier when the rollouts happened, right?
Yeah.
Those who were younger, those who had less comorbid conditions, probably got their vaccinations later on in the country cycle.
Okay, can I ask you, Monica, I don't know if you showed this, here in Australia, a significant number, particularly older people, got the vector, that is the AstraZeneca vaccine. And then, of course, another group, a lot of got the Pfizer. But now the booster is going to be only at least only the Pfizer one has been approved. So combining I think you just showed some evidence from Thailand that combining the vector AstraZeneca then with the booster with the Pfizer has been shown to be good. Is that right? In terms of neutralizing antibodies getting pushed up?
So this is actually data that's from a long time ago. We do know that those who have received AstraZeneca followed by Pfizer have had the best outcome in terms of triggering potent immune reactions. We've known this as early as May of this year. So I definitely recommend that that if you have received the AstraZeneca, that you should definitely follow it up with the Pfizer. And maybe that's the reason why. That's the reason why that the Pfizer has been recommended for the booster dose. So here, this is like the New York Times. This was published in June of 2021. And then it says here, early results from a British vaccine study suggest that mixing different brands of vaccines can provoke a protective immune response. And so after getting 1 dose of Pfizer and 1 dose of the AstraZeneca. So I do believe that Australia has done the right thing by approving the Pfizer as the booster dose.
Thank you, Monica.
Dr. Pillai from India. It has been a very informative talk. 1 or 2 situations I would like to present. One is that in our clinical practice, when we admit the patient, normally we do antigen test, and in certain cases where we find that in spite of the antigen being negative, their recovery pattern is not satisfactory post-operatively or otherwise. When you do the antibody values go even up to 4,000 or even 40,000. So very, very high antibody levels in patients who are not responding normally to their illness and their treatment. So this is a scenario that we find very commonly. 2 things. One, of course, how can we explain this phenomenon? Second, of course, is whether they can be given booster dose. But booster dose, normally it is an accepted public health, no, because for most of the vaccine related diseases, we are giving booster dose, whether it is polio or whatever. So booster dose is normally practiced. But with the COVID, the issue is that the variability in the antibody level and high antibody levels, whether does it influence or adversely influence giving the booster dose?
Thank you for your question. My understanding of the question is that you have a patient, they're COVID positive, they have high antibody levels, yet they continue to have potentially long COVID symptoms. Giving them vaccination is recommended, but you're wondering if there is any deleterious effect of giving the vaccine to these patients who already have high antibody levels. Is that correct?
Exactly, yeah.
Okay, so in that scenario, I am going to say, as you know, in the US, we're not testing antibody levels. We have no idea what their antibody levels are. So we have a wide range of people who have antibody levels, patients that we're immunizing. What we do know, or what we have seen as anecdotal, is that we see that patients who have had long COVID symptoms, when they get immunized, that they find some benefit. Not complete, but it seems to accelerate the recovery that is very delayed. I can't source where I read this, but one of the mechanisms of actions that I had heard about this is that they say that when you have long COVID symptoms, you're having microthrombi. The microthrombi are trapping the virus particles. When you have long COVID symptoms, it's that you have constant immune and you have constant inflammation occurring because of these viruses that are trapped in these microthrombi. By getting the vaccine, even if you have antibody levels, you have an all immune, you have T cell immunity, you have B cell immunity that all gets revved up. And that's able to attack these viral particles in these microthrombi that causes dissipation. And then you end up getting some symptom relief from the long COVID. Again, I can't quote, I don't know where I sourced that, but I did come across that as one of the mechanisms of action. When we give the vaccines, it's more than just B cell humoral immunity. We have T cell, cell-mediated immunity as well. And it requires both sides of the immune system. And so when you get antibody levels, that is one marker of an immune system being activated. But the immune profile changes with vaccination. So I do believe that as long as there's no other contraindication to receiving the vaccine, that they should definitely get it. And you should definitely try to follow up to see if their long COVID symptoms improve with the vaccination.
Thank you. This Israeli data that is available, after the booster dose, they have found that the side effects are less with the booster dose than with the second dose, particularly myocarditis in the younger generation. How can you explain that phenomenon?
Because the second dose occurred closer to the first dose, and the third dose is occurring months afterwards.
So is it related to the level of antibodies, or independent of that is happening?
I think there are multiple factors that are involved. You're taking a potentially completely naive immune system to the virus that gets the first dose. The second dose is definitely a stronger because its time interval is 3 weeks, 4 weeks. And then when you get the second dose 6 months, 9 months down the road, there's been so much of a waning of not just antibody levels, but everything, that maybe that's why it's tolerated. Also, the Moderna booster dose is 1/2 that of the regular dose, whereas the Pfizer dose is the regular dose. When we're looking at all booster side effects, we also have to keep in mind that the Moderna dose is also 1/2 of the original dose.
Okay, Saurabh, can I say something?
Yeah.
Hello, Saurabh. Okay. Thank you very much, Saurabh. Good morning, everybody. And I'm sorry I couldn't attend last Saturday, and because of my professional commitment today, I'm again busy. But I heard whatever the questions were asked, very interesting and very informative answer being given by Monica. I have a question, Monica, that how many doses as a booster dose can a person have?
So that's a great question. So I actually asked one of the PhD researchers in Milwaukee who's actually studying booster doses for Pfizer. And this particular individual said to me that they are testing the 4th dose. But whether or not the recommendation is to make the 4th dose available, to me seems not very pragmatic, given that there are so many people who remain unvaccinated. So earlier I had stated that I have not gotten my booster yet because I want to prolong or I want to get my booster later on in the winter season when we have a surge of more flu cases, so that I feel that if I did get any viral symptoms, that I knew that I was better protected in case I got COVID. Having said that, if people are getting their booster dose in September, that means by March that they are going to be theoretically ready for another booster dose. And that 6 months after that would be September again, which is when we typically start getting the flu shot and when we expect that all of us will be getting the COVID vaccine along with the seasonal flu vaccine. The recommended number of doses is 3 so far. There have been no formal recommendations about a 4th dose, unless we're talking maybe that there are special scenarios in those who are immunocompromised, people who are on immunosuppressive medications. But I have not seen, and there might be data out there regarding 4th doses or more than that.
Okay, but the problem is that I heard from even the health workers having 2 Chinese vaccine in the beginning, and then they have 1 booster Pfizer, and then after 1 month the other the 4th vaccine or the second Pfizer after 1 month. So totally 2 Chinese vaccine and 2 vaccine of Pfizer as a booster. Is this recommended? And I met one of the person who have taken 3 booster dose of Pfizer after taking 2 Sinopharm dose. Is it a correct thing to do? I don't know. The people are some people are very much conscious or want to be more vaccine and to be more safe with the corona. What do you think?
So what you are saying is some things that I've heard here as well. What I'm showing you here now is that the FDA and the CDC have recommended that officially a 4th dose can be given when the patient is on chronic immunosuppression, active cancer, solid organ transplant recipients, HIV infections. So this is the 4th booster dose recommendation. From a practical scenario, I have heard of many people visiting the United States and who received 2 doses of non-mRNA vaccines, who've gotten the 3rd dose when they arrived here. They stayed here 1 month and then they got another dose on the 4th dose. So if you were asking if I recommend it, I don't recommend it. I would say that 1 dose is enough. But have there people who have received 2 doses? I think there have been many people who have received 4 doses. I think that we just don't know. We don't know if they have had side effects. We don't know what their efficacy level is. We don't know how to understand the profile of people who are not receiving the vaccines outside of the current recommendations. But yes, there are people who are receiving it.
Thank you very much, Monica.
There's one question. Like a lot of people in India, especially, they had a fear of having vaccine initially. you have a vaccine and suddenly you see, oh, because of the vaccine, there was a death, which was absolutely not true, because there could be a comorbid disease, which would have, something like that. So there are people in India who have only one dose of vaccine, who have no dose of vaccine in what is present in India. So somebody who just had one dose of vaccine and doesn't want to continue with the same vaccine, can he change the vaccine and go for a booster dose, or does he have to complete the recommended dose of the particular vaccine he had and then go for a booster dose?
So I would recommend completing the initial vaccine series and then getting the booster dose as a mix and match.
Even the gap period has gone more than 4 months, 5 months between the vaccines?
Because if you recall, there were many countries who did not receive the vaccine on time for Pfizer and Moderna who were getting those and who did recommend 6 months, 4 months. Some of the British Commonwealth countries had been doing that. And so they actually found that there was a strong immune response. But I feel like if you are going to get a proper immune protection, I think you need to follow the initial series and then get the booster with the mix and match if you don't want the same one.
Thank you. Any other questions on the floor? Otherwise, we'll just have a quick update. If Chong is trying to speak, he's on mute.
Monica, can I ask a question?
Yeah.
Or make a comment?
Go ahead.
Can you hear me?
Yeah, we can hear you.
Thank you.
Yes. In Singapore, for example, all the citizens and people living in Singapore, permanent residents, etc., anyone resident in Singapore have received 2 Pfizers, and now 22% of the population have received a booster, which is an mRNA booster. At the same time, there's been a group of patients who are quite hesitant to receive mRNA vaccines, and they have received 2 Sinovac or 2 Sinopharm vaccines. And now our current recommendation in Singapore is that we give a 3rd Sinovac or a 3rd Sinopharm to these people, these patients, in 3 months after the 2nd shot. So in effect, what we're actually saying is that Sinopharm and Sinovac is a 3-shot regime as opposed to a booster, if you understand what I mean. So mRNA is 2 shots and Sinovac and Sinopharm is actually 3 shots. So that's the situation here we have in Singapore. There are a lot of patients who have, for example, there are a lot of Singapore citizens who have come home from abroad to Singapore, and they have received 2 Sinovac or 2 Sinopharm, and the Singapore government here has given them 2 Pfizer or 2 Modernas, so they have received 4 shots. So these are some of the things that we are seeing here in Singapore. Have you any thoughts on this?
So that's just speaking in line to what the prior question was about those who are receiving 4 doses and receiving 2 doses of one series and 2 doses of another. I'm not as familiar with the outcomes of Sinopharm and Sinovac, but if they're getting 3 doses and the 3rd dose is 3 months away, I do believe that that would be beneficial, because I do not believe that they've reached the same level of efficacy as the mRNA vaccines. So it sounds great to me what you are doing in Singapore. I would not change the course. I think when it comes to achieving this level of herd immunity, having a variety of vaccine schedules is much better than every citizen getting the same vaccine at the same time. So we have a heterogeneity in the background of the individual that's receiving the vaccine, and we have a heterogeneity in the vaccine schedules as well as the vaccines themselves. And do we have all the right answers? No, but I really like hearing what you just said, because having that is really going to promote herd immunity.
Yes. I think the reason for the 3-shot Sinopharm or 3-shot Sinovac vaccine regime, we also have mandates in Singapore, vaccine mandates. For example, you're all carrying an app, and you need to be shown that you're vaccinated before you are allowed into a restaurant and so on, or a public sector, public place. So essentially, what we're actually saying here in Singapore is Sinovac and Sinopharm has to have 3 shots before we call you vaccinated. So that's actually what we're doing in Singapore. But I must admit that I'm a little bit concerned, because actually I don't think there's data to show it. It's just that our local experience has shown that 2 shots of Sinopharm and 2 shots of Sinovac have not worked very well as compared to the Moderna and the Pfizer's.
And that would be definitely a case for getting a mixed match mRNA followed by the Sinopharm and Sinovac. And when it comes to the skeptics about the safety of these vaccines, I mean, think about how many people have gotten these vaccines. Whatever the barriers are to understanding the safety, I think they've all been addressed by now. So.
Yeah. But at the same time, even among my cardiologist colleagues, I must tell you that I hear a lot of anecdotal stories of atrial fibrillation, arrhythmias in rather young people. You know? Yeah. So there's a lot of, especially my cardiologist colleagues seem to be quite worried, you know, especially when coming to giving mRNA vaccines to their children. So they've been quite, I hear stories about teenagers getting atrial fibrillation and so on. So we have heard stories like that. And I don't know, again, you know, these are all anecdotal, so
yes.
a bit difficult. Yeah.
Yes, and that goes with any discussion about any immunization that we give to anybody. It's always a risk-benefit ratio. And yes. So everybody has to find their own. The discussion about ideal vaccine is when no other concerns exist, right? It's like how we approach everybody and all our patients. But when the concern exists, you discuss the risk-benefit and then you modify the plan.
Yeah. Thank you.
You're welcome.
If we have no more questions, we'll have a quick update. And I would just like Monica to start for the US update, because I think the cases in US is the only where we hear that it's going up, or it's probably not going down or something. But every other places, I think the cases have been down. Would you like to have an update on US? Meanwhile, till Monica, we can, yeah.
Sorry, I'm just going to share the screen again. So in terms of the cases, again, just wanted to share this in terms of where we are with the number of cases. We are in this dark blue line here, and our cases are going up. In the state of Wisconsin, we're about 3,500 cases a day in the last 3 days, where we had a 7-day average that was in the higher 2,000s. Our hospitals are full, our ICUs are full. We're in surge staffing right now, where our providers, physicians are getting pulled in to take care of COVID patients. We are definitely having a lot more, but that's all I'm going to say, because this slide shows where we are today. And then I had shown you the data regarding the immunization status of those who've received the full vaccination 2 series versus also now the booster immunization. And with the new CDC guidance that every adult is eligible to receive the booster dose, given the data that we know of waning protection against infection, hospitalization, and fatality, that we are going to see now an uptick in those who've received the booster doses. Okay.
Dong, would you like to take for the Singapore?
Yes, please. All right. In Singapore, we've been having a surge, as you're aware. I think I've reported to you, all of you, last couple of weeks. We're having a surge in Singapore, but the surge seems to be coming down. We have hit a peak of 3,000 to 5,000 cases a day. Today's data is about 1,700 cases, and we have 1,003 in hospital. 200 require oxygen supplementation, 46 are under close monitoring in ICU, 64 are critically ill in ICU. Overall, ICU utilization rate is about 57%. Now, what I wanted to say is actually very interesting is, okay, from what I understand from my public sector hospitals, that essentially what we're doing is a patient with, for example, in the 70s and 80s who's not vaccinated or who's vaccinated but has tremendous comorbidities, given remdesivir, given IV steroids, given high flow oxygen mask, 60 liters per minute, and subsequently, it's a sink or swim. If it's sink, maybe no intubation. So quite sad, and therefore we're getting about 10 to 15 deaths daily. So this is a real situation on the ground in Singapore, because we are very concerned about our ICU beds, and and that's the real situation. But a lot of these patients have tremendous comorbidities, liver, kidney, so on, cardiac, and so on. That's what I have to say about Singapore.
Dr. Pillay?
Thank you. Before I brief about India, one more question to Monica. See, a person has had an infection without the PCR positive and all. He had the first dose and the second dose. And then when has to be the booster dose?
So you're asking when should they receive a booster dose after they've had an infection and the infection followed the initial series?
Yeah.
So that's a great question again. And this was a question that I tried to answer earlier, and I was not clear in my answer, and I know I wasn't clear. And that is that once the infection is resolved, and depending on the surge that you're having and what the anticipated risk is, you should use all of those factors and take that into mind. For example, today, when you have had 9-month gap since vaccination, you say you got sick 2 weeks ago, and you're going into a very high risk Christmas vacation scenario. You're anticipating meeting family. My recommendation is to get the booster dose, even if you got the infection 2 weeks before Christmas, before you meet family. If you're planning to stay at home, you're isolating yourself, there's no risk for exposure, I would say wait until January. That way you would then prolong the booster protection later on into through the flu season. So I think that it's not a hard and fast. I don't believe that the infection precludes you from getting the booster dose. The infection and the immunity that is gained from infection is what I believe the CDC had reported last week as being 5 times less than that of immunization. So I do believe that booster immunization is much better than natural infection. And therefore that booster dose should not be precluded because of infection, and should be timed according to the risk of that individual.
Thank you. Coming to Indian scenario, immunization definitely is going at a very rapid pace. 110 crores of people have been vaccinated, and double dose, almost 45 to 50% population has, eligible population has it. And single dose, definitely 60 to 70% population already have it. But the best part is, I could confidently say that India is a country where we have really controlled COVID, because now the number from 4 lakhs per day, it has come down to 10,000 per day, and that too in certain areas only. And so the pandemic has gone, and it is more or less the epidemic stage where pockets of infection only is present. So that definitely is a great achievement for a vast country like India. And we normally don't expect a third wave because things are under control. Of course, there have been a lot of people who are asymptomatic infection, and so the community vulnerability has come down. So that's where we stand. There are certain cities or certain states where 100% eligible population has been vaccinated. Some of the metros, it has been first dose 100%. Some of them, even the second dose, 100% eligible population has been vaccinated. Regarding the variants and all, it seems that even the variants, Delta variant, it has become little less hostile because serious infections and hospital admission, even among those who have it, has come down considerably percentage-wise, 0.8% only getting admitted. And monoclonal antibody cocktail, now we are giving as an outpatient treatment, getting them admitted for a day, give the injection, and none of them has come back with further deterioration. And when you do the RT-PCR after 10 days, in all of them it is negative. So even the treatment protocol we have changed to the extent that even the injections are given as a daycare case, and so that long hospitalization and the strain in the hospital and health workers definitely has come down. So we are in a positive mood, but we are not relaxing our vigil, and vaccination process definitely going to every house, even the tribal colonies, and getting them vaccinated. That process definitely is happening. So we can confidently say that India has tide over the situation, but the vigil has to continue. COVID appropriate behavior still has to continue. Thank you.
Thank you. Can we have Dr. Ravi?
Yeah, thank you, Saurabh. Malaysia, well, as of yesterday, we are hovering about 6,000 plus. So we are hovering between the 5,000 and 6,000 for the last maybe week or so. In terms of adult population, 94% have been given 2 doses of vaccination. And for the adolescents, about 70% have been given the 2 doses. Now we are on the 3rd dose, the booster dose drive now. Starting off with the frontliners and those above 60 with comorbidities, and even those below 60, those with comorbidities are being advised to take the booster. But like I was telling Monica earlier, the biggest concern is here for those who have taken 2 doses of Sinovac, and now to take a Pfizer as a booster is something that they're all very apprehensive about, because the booster, the only vaccine that is being given is the Pfizer. Like I've taken my booster, mine was Pfizer, was the first two, and now the 3rd one was Pfizer. So many people are worried. So the government has actually reported that 40% do not turn up for their booster dose. You see, because we have the apps like Singapore, where the apps will inform you what date and at what time and where you go and take your booster dose. So many of them, what has happened is about 40% have not turned up for their booster. But the option given to the doctors is they can immediately call somebody else, because booster, as you know, they come in a while of, I think, 6 doses. So they call up other people to come and fill in the vacancies. So this is where the greatest concern is. Sinovac, taken Sinovac, can they combine with Pfizer? So that is a major problem. As for deaths, we are having about 50 to 60 deaths daily in comparison to 200 and 300 deaths in the past. So I think our situation is improving. However, life has gone back to normal. People are just walking around as if nothing has happened, like as if it was pre-COVID, except that by law, you have to use a face mask. And anytime you enter any complex shopping, restaurant, anything, you must have your scanning done. We have this thing called the My Sejahtera apps. And in that, it will show you have been vaccinated or have had any close contact with COVID and all that. So that part is still being enforced. And people are moving around. I mean, traffic is back to normal as far as I can see. So I think life is almost getting back to normal. Thank you.
Okay. Dr. Anjali and Dr. Akhtar Hussain. Can we have an update from South Africa?
Can I give the South Africa?
Yeah, sure. Go ahead, Dr. Akhtar. Can you hear us?
Not sure whether he's struggling. Can you hear me?
Yeah, we can hear you now.
Okay. While Dr. Atkar is still trying to get in, just want to reiterate what I've just said before the meeting started, that there is a slight, we didn't see any cases, especially in Gauteng, or not any cases, very few cases. Our infectivity rate was, for the past few weeks, less than 1%. And all of a sudden, last week or the past week, we started to see an increase, and our infectivity rate jumped up to, I think it's 2.6 today. I'll let Dr. Atkar, if he can come in to get the rest of the stats, but that is for Gauteng province. So we are very concerned. We are watching this. And the patients that I have seen that's positive, half of them are adults, half children. One of the children were quite sick. And the adults, one was not fully vaccinated yet, that was positive, and the other two was not positive. So I was not vaccinated. What is interesting to me is the moment that you make the diagnosis to the patient, that you are positive. So you start the conversation with, have you been vaccinated? No. And you can see the defiance, why should I vaccinate? And then once if you make the diagnosis, then they want to cry. I don't understand this. I said, that was your choice. Why are you now upset because you're positive? Because then the reality kicks in. And I think that is something people doesn't understand. It's all great to be an anti-vacciner, but the moment when you get the diagnosis, you are then upset. Doesn't make any sense to me. So Dr. Atkar, can you give the rest of the stats? Can you come in? I think we lost him. But in a nutshell, we are seeing an increase. We'll have to watch it. We'll give feedback next week to you guys. It is concerning. Our festive season is starting about in the same time, about 3 or 4 weeks from now on. So I think we'll see what happens. Thanks.
Thank you. Can I have an update from Pakistan? Dr. Sajjad or Dr. Salma or Dr. Wazir? Yeah.
Okay, Zurab, I'm here, Dr. Kaifar Sajjad. Actually, Pakistan, thanks God, is very good situation. The number of cases is absolutely going down today. Within 24 hours, we have only near about 400 cases in Pakistan, and the number of vaccine being given to the people are increasing day by day. Near about 45% people are vaccinated here with a single dose, and 28% with full dose. The situation is good. Everything is open. The normal life is running in Pakistan, and we hope that in near future it will be absolutely settled down from the corona point of view, and more people will have the vaccine which is available in Pakistan, the Chinese, the Pfizer, Sinopharm, Sinovac, and the Pfizer vaccine. So this is all about from Pakistan. Thank you very much.
Okay. Any final comments from Dr. Salma or for Pakistan? I see her.
Yeah, I would. Good morning, everybody, or good evening, wherever you are. Sorry, I couldn't join you for the last few weeks. I've been very busy. So, Rab, whatever Dr. Kaifar said, I second it. My only question to the forum is, like, you all are encouraging the booster dose, that is the third dose. So my question to all the great minds here is, I'm very happy with the Chinese vaccine, and I've had Sinopharm. Can I get the booster dose of Sinopharm? Because many people are recommending mix and match. They're encouraging Pfizer. But would the Chinese vaccine be all right? Thank you. That is my question.
I will let Monica answer. We already answered that question before you joined in, but I will let her answer
Oh,
this
I'm
question.
so sorry.
Oh, no, no worries. So what we know and what we can extrapolate from data from other studies regarding booster doses is that achieving a booster dose is definitely efficacious. I am going to show a slide that you might not have seen earlier, and this was preprint data that was recently published. And this is why they are recommending the mix and matching. And so what you're seeing here, is, let me go back. So what you're seeing here is looking at the neutralizing antibody levels. Okay, and what you're seeing here is the neutralizing antibody levels. So we're going to say that the Johnson & Johnson is the non-mRNA vaccine. And so they got the dose and say that we compared that to the other non-mRNA vaccine like the Sinopharm and the Sinovac. What happens when you get a booster dose of an mRNA vaccine? What you are seeing is the Pfizer BioNTech is giving you 35.1 times average rise in neutralizing antibodies compared to that of the Moderna, compared to the Johnson & Johnson, which is only a 4.2 rise. The Moderna is a 75.9 times rise in the Johnson & Johnson. And what you are seeing here is the effect of an mRNA followed by a non-mRNA vaccine and showing incredible response with the Moderna booster on the Johnson & Johnson. Now, I know that the vaccines are different than the ones that you are talking about. If you're saying, should I get a third dose? Yes, you should get a third dose. If you are hesitant to get an mRNA vaccine, any vaccine will be fine. However, the data of mRNA vaccines is showing that it is much more efficacious to receive the different platform vaccine, which is getting a vaccine from a different family, right? So you've got Sinopharm, Sinovac, and this is an inactivated vaccine. Better to get a vaccine booster that's an RNA or viral vector. So, but I understand that there's hesitations. There's concern for side effects. There's concern for side effects that may not be known, but we do know that many, many people have gotten Pfizer. Many, many people have gotten Pfizer and have safely gotten Pfizer under the concerns regarding these vaccines that have been raised. And so you should be able to get what vaccine you want, but I do believe that mixing and matching will be of benefit. I hope that answers your question.
Okay, thank you so much, Monica.
Yeah. Quick update from Russell.
Well, in Australia, we are probably stabilizing. Victoria just reached 90% of the population from 12 to above have been vaccinated, and so all restrictions. So Victoria and New South Wales is 94%. So these two have been opened up completely for those who have a vaccination. Those who don't have vaccine still have some restrictions. So all other things have happened. We still have some cases, but the interesting thing is that although we are having cases, the 7-day hospital admission is dropped to 300 or so. So it's dropping down, and I think the ICU2 is dropped, and the 5 to 11 that is being, I think, expected next month. It's at the moment with the TGA, and so we hope to start vaccinating that group from January. That's and of course the booster has already started. So anyone who's supposed had 6 months for the last dose can go walk in and get the booster. So things are probably moving in the right direction at the moment in Australia. Yeah, we had some deaths every day from this, but it's 3, 4 I think today, and like this it goes on. But yeah, that's where it is now.
Thank you. Thank you, Dr. Russell. Dr. Wazi Kazi, you haven't spoken. Would you like to make some comments before we can close the session? If you're still there.
Okay, thank you, Sarab. It was really wonderful and very informative presentation by Monica. She really updated us what the latest is happening around the world, and especially about the booster vaccinations and vaccination in children. It was really wonderful. And the questions being asked by the participants, they were very nicely answered and cleared all the, myths and, misunderstandings, and cleared the concept of vaccination. So it was really wonderful. And it's always been a pleasure listening to Monica. Thank you, Monica, and thank you, Sarab. You conduct this program very well. It is really good to see you, with your determination and sparing your time and, giving us the update of the regional situation that makes us, very knowledgeable about the things which are happening around the world. Thank you, Sarab, and thank you, Chong, for your update of Singapore, and everybody for giving their update about their country position of vaccination, the COVID cases, and the planning for the future. Thank you, Sarab.
So with this note, thank you so much for joining for the 85th CMAAO session. And we will take a leave for this session. We will join again the same time, same day, same ID, Zoom ID. This is an add-on, same ID, Zoom. Every week we are here meeting the National Medical Association. Thank you, everyone. Thank you, Speaker Monica, joining at the last moment. It was a much needed update for vaccine, booster vaccine, and all other concerns and questions which all the medical associations have. This brings smile on everyone's face. Thank you so much.